Welcome to the Art of Healing podcast, the podcast that is dedicated to helping you connect with your mind, body, and spirit. This is Charlize, physician and Reiki master, and thank you so much for joining me. I would like to remind you that although I'm a physician, the information you receive in this podcast is for educational and entertainment purposes only. You can find my full disclaimer at my website, www.healingartshealthandwellness.com. If you like what you hear on this podcast, sign up for my weekly newsletter. Check your show notes for more information and for the link to sign up. Thank you. This podcast episode will be discussing medically related issues. I would like to remind you that although I am a practicing physician, this podcast is for educational and informational purposes only. This is not medical, mental, or religious advice. This is not legal or financial advice. And it is your responsibility to pursue medical care as recommended. Please see my website for further information on this disclaimer. Thanks. Hello and welcome back to the Art of Healing podcast. This is Charlize. Thank you so much for joining me for today's episode. For the month of February, I am going to be focusing on chronic pain. I'm going to cover again the information on inflammation. We're going to make a link between inflammation and chronic pain. And then we are going to also discuss the energy body's connection to chronic pain. So I'm planning on covering all of that for this month. So for today's episode, this is going to be chronic pain and the use of holistic remedies, part 1. And I want to spend an episode discussing the types of chronic pain. I think it'll be a good basis to discuss everything else as far as addressing chronic pain. I don't know the exact statistics, although I'm quite sure that in my own practice, chronic pain is going to be among the top 3 diagnoses of why patients come in to see me. And it's a fairly well-known topic that had been being discussed pretty often prior to the pandemic of 2020, which of course took center stage in the healthcare world. Chronic pain is one of those topics that, although it had been discussed more and will come up more, especially because there will be so many individuals dealing with chronic inflammation related to having had the coronavirus infection. It is definitely an underserved, still under-discussed topic. And the nature of healthcare now is that, for the most part, we just don't address this topic effectively. So as I was deciding on topics and things that I wanted to discuss, this has been very much the top of my mind, up there with insomnia, as well as weight gain. There are 4 types of chronic pain that we will discuss. I'm grouping them into 4 major groups. There are really going to be a much larger number of diagnoses that can lead to chronic pain. But for the sake of our discussion, the 4 types of chronic pain that we will discuss is I'm classifying them, are musculoskeletal pain, neuropathic pain, immune-related pain, and generalized pain. So that's going to be our approach. This is by no means a comprehensive list. I'm mostly speaking to my experience as a practicing physician and what I see. The first type, musculoskeletal pain, which is going to be chronic pain lasting more than 3 months duration. And this is pain that's going to be coming from the joints or the lower back. Chronic pain originating from these sources. And the most common types of chronic pain lasting over 3 months or over 6 months that I see in my practice is going to be pain originating from the lumbar spine and pain originating from osteoarthritis. Lumbar spinal pain typically is going to show up a number of ways, and this is going to be someone who's experienced moderate to severe lower back pain for at least 3 months or longer. And these individuals suffering from lower back pain may have had imaging diagnostics, maybe not. And it could also be that they've had a pain that's been intermittent. It's been gone at times, and then at times it's come back. And the most common diagnosis that I think of, I don't know that it's necessarily just, the numbers are there, but usually what I see that comes from this is going to be lumbar disc degeneration and spinal stenosis. Both those conditions are degenerative diseases, meaning that they are going to be damage to the vertebra or the bones, leading to damage of the connective tissue, the intervertebral disc, that can lead to impingement of nerves that would supply sensation down the legs. Sometimes we call that lumbar radiculopathy. Or sometimes some people think of it as sciatica is one example. Not quite, doesn't quite line up because of the locations, but basically this is going to be lower back pain from something degeneration, which relates to time, weight, gravity, force, chronic inflammation that leads to pain in the lower back, which I believe for most years is going to be the most common cause of chronic pain. The reason that patients would be seeking remedies for pain relief, seeking interventions, procedures, and even surgeries to relieve this pain. And for many years, it had been chronic low back pain that had led to the use of opioids, which is a difficult topic because a lot of times if we don't look for some way to relieve this lower back pain, dependence on opioids occurs. So this kind of lumbar pain, probably the most common, and can be excruciating and can definitely lead to changes in the quality of life, can occur pretty commonly. Almost any of us can actually have issues in our lower back. If you consider the job of the lumbar spine is actually to be a weight-bearing structure as well as a cushion against gravity. So it's holding the weight up of your torso, of your abdomen, your chest, your head. Then it's also shock absorbing, so that every time one of your feet hits the ground when you're walking, some of that force transmits up to your back and reaches the lumbar spine. So it's no surprise that this would be a common place to have chronic pain. Osteoarthritis, which I classify with the musculoskeletal chronic pain, which is also degenerative, meaning a disease process that happens over time. And arthritis is going to be a combination of mechanical injury, inflammation, the body's attempt to heal the area, leading to further inflammation and damage, gravity, and depending on location, weight. Common places for arthritis, osteoarthritis that would lead to chronic pain would be the knees and the hips. And then another place that we can see chronic osteoarthritis that isn't always so much, it really isn't weight bearing, it's more inflammatory, is osteoarthritis of the hands. Knee osteoarthritis and hip osteoarthritis can occur for a number of reasons: old injuries, old trauma, but keep in mind the degenerative nature, meaning that time, mechanical stress, in combination with the body's immune system activating to attempt a healing process, leads to destruction of the ligaments and cushions. For example, within the knee, there's structures that serve as cushions that become prone to damage. This can allow areas that should not rub against each other to start to rub. So people have heard of the term like bone on bone osteoarthritis. And then the synovial fluid's role in trying to heal this, where the synovial fluid will become more inflammatory in an attempt to contain this damage. And all of that can lead to pain. And a similar process happens as well in the hip. Osteoarthritis of the hands is interesting, and at least as far as I know in my practice, it seems like it occurs more in women. And what we see is that same thing, that degenerative nature, so it occurs over time along with use. And we see the joints of the hands become tender and they change. They become a little bit larger over the years. And sometimes when we see the arthritis of the hands, we start to wonder about another condition, rheumatoid arthritis, which we'll discuss. But we may do tests and those may come back negative. Osteoarthritis of the hands, although I do think of it as musculoskeletal, because these joints are small, and at least right now what we know, we don't have any specific test that tells us that this osteoarthritis of the hands is a distinct condition from rheumatoid arthritis or the osteoarthritis of the knee. I often will educate my patients on anti-inflammatory measures in their lifestyle to help with the arthritis in the hands, including limiting the intake of sugar, consuming good fats, exercising the whole body so that the immune system can be optimized to heal the damage that's happening in the hands. Osteoarthritis in some of the smaller joints happens, but not quite as often. It's really going to be the hands that tends to be what I see the most in my practice. So with those conditions, the musculoskeletal issues for chronic pain, the back, knees, hips, and then hands are kind of what we see the most. Next, source of chronic pain being neuropathic pain, meaning this is pain that originates from nerve damage. Neuropathic pain, I break down as I'm assessing patients, is this pain originating from the central nervous system or the peripheral nervous system? So if it's from the peripheral nervous system, meaning the nerves, it's likely going to be called a neuropathy. Neuropathy meaning nerve pathology. And so as far as neuropathies, it's fairly common, unfortunately, probably becoming more common, is going to be nerve damage related to diabetes. So related to metabolic dysregulation, which we call diabetic neuropathy. Diabetic neuropathy typically involves the feet and the legs, although it can involve the hands. It can be incredibly painful, and it is caused by elevated levels of glucose causing damage to the nerves that supply the motor and sensory function to the legs and feet. What I often tell my patients is that many parts of our body, we're lucky, regenerate very easily, and our body's healing process, the way our body heals ourselves, is miraculous. As long as we don't get in the way of it, our human bodies can recover from a lot. Our nerve tissue is a little bit different. The nature of nerves, the nerves in your brain, as well as the nerves in your legs and feet, are that they don't really regenerate, or it takes a very long time for them to recover. So they really require a lot of protection from damage from the body, from the system. The nerves in the legs and the feet are especially prone to damage from high sugars. And basically, sugars, glucose, can be corrosive, is a good way to think of it. So too much exposure to that corrosive material damages those nerves, leading to painful sensations that can be described a number of ways, from just numbness to tingling to stabbing to burning, or even like a sensation of can't rest the legs. A number of ways that diabetic neuropathy can present, but a very important topic as far as understanding origins of chronic pain. It is possible to have neuropathy without diabetes, which sometimes we'll call idiopathic neuropathy, meaning that we may not understand the inciting cause of it, or sometimes we might. So we might know that there was an toxin exposure or a viral exposure. It does get into a much deeper area, and definitely more of a neurologist area. But it's important to highlight that it is possible to have neuropathy without necessarily having the diagnosis of diabetes. There is a fairly rare condition that I try to keep at the top of my head when I'm working with patients that involves both the nerves as well as the blood flow to a region called regional pain syndrome, which is basically a result of trauma to an area leading to arteries and nerves having a dysregulated, dysfunctional relationship that can cause a severe chronic painful condition in one limb. It can be very difficult to diagnose and very difficult to treat, but it's nice to have an awareness of this, especially if I'm working with a new patient that has pain that's not very well diagnosed. Central nervous system chronic pain, and probably you'll be able to infer that this is going to be migraine, tension headache, any sort of reoccurring headache would fall in this category. And of course, migraines can be episodic. Many times when they're first diagnosed, they are episodic. They're not occurring very often, maybe every few months or once a month. But migraines can evolve into a frequently occurring event and then even a chronic event. Migraines are caused by an issue in the covering of the brain that causes some of the blood vessels to act up. That leads to pain. The pain's not actually from the brain itself, it's from the covering of the brain. But migraines, as well as classified tension headaches, which could be musculoskeletal, but those are basically going to be from muscle tension in the neck leading to a pain from the head, are important to realize that they can be classified as chronic pain. And particularly if something like a migraine has evolved into a daily event, it can be hard to actually piece out the diagnosis exactly what is this because of the way it's presenting. But in my world, when I'm working with patients, I do put this in the classification of chronic pain, someone that's having a daily headache. Immune-related chronic pain, and I actually forgot one. I guess I'll mention it here. Is going to be generalized pain is a broad topic, but immune-related pain, I will think of in my head in this way because now we're getting into chronic pain issues that are from a diagnosis that are going to be non-localized. So these conditions can cause pain and symptoms in multiple parts of the body, and likely they do. So one of those diagnoses that often will mimic another, so a type of chronic pain that's really going to be the immune system, but it seems like it's just from one region, is going to be rheumatoid arthritis. Rheumatoid arthritis is going to be activation of the immune system, one component of the immune system, to start attacking a particular structure in the joints, which will cause pain and swelling and stiffness, and over time, actual destruction of the joint where the joint becomes hard to use. Rheumatoid arthritis can often be confused for osteoarthritis, particularly if it's presenting with initially just one joint that's involved. But I like to point out it's non-localized. So because the core problem is going to be the immune system being overactive, and then a number of inflammatory markers being high and activating the immune system in a number of ways, that rheumatoid arthritis can cause pain in really any joint, and can also cause pain in non-joints, muscle pain and headache. The difference with these inflammatory or immune-related chronic pains is that these are ones that we tend to try to diagnose as rapidly as possible because of the nature of the disease. They may not be limited to just joint and muscle pain. We could be having immune-related damage to the heart, the lungs, and other structures. So rheumatoid arthritis will often present with stiffness in the morning, joint pain and swelling in the morning. It's kind of the classic, but it's definitely not limited to that. It could be pain in the hands, the feet, ankles, knees. Again, non-localized, so it could be pain anywhere. As a diagnosis, it can usually be confirmed with lab work, but that's not always necessary or mandatory. And oftentimes, we may want to get imaging to see if any joint damage is happening that's visible. And with these sort of immune-related non-localized chronic pain, we typically are going to need the help of specialists that treat these kind of diseases, because we may need to use injectable medications or other type of medications to calm down the immune system. The next that I'm mentioning, although really it's, as far as the numbers of it, is not very common, is going to be lupus. Often many of my patients are concerned that they may have lupus. And again, it's going to be a source of chronic pain, similar to rheumatoid arthritis, where the immune system's been activated and the body is generating weapons against its own tissue. The suspicion for lupus in many patients is going to be high because of a number of symptoms they may be presenting with, including fatigue and joint pain, skin changes and rashes. But actual confirmation of the diagnosis is really not very common, but I thought it's worth mentioning because when I'm working with patients, they often mention to me, could this be lupus? Lupus is different from some of the other autoimmune diseases in that the sheer number of bodily areas that are involved are very high. And oftentimes we don't just see damage to just the joints. We can see organ issues and even issues in the brain and digestive system. And then under immune-related disorders, actually going to be a number of disorders, a really long list that I don't even know all the diagnoses, but we'll sometimes call those mixed tissue connective disease, and basically, non-localized immune system's been activated and causing pain in multiple areas of the body, including the joints, the connective tissue of the joints, or in other places. So the key with immune-related chronic pain issues is that although we still need to address the chronic pain, we probably are going to need a step as far as helping the immune system calm down with medication as well as with lifestyle. Finally, there is a class of diagnosis, or I think of them this way, just generalized pain, that although we may call it just this one thing, I think at some point as science develops, as technology develops, we'll have a much better way to describe these. And that would be fibromyalgia or chronic fatigue syndrome. And these are going to be non-localized pain syndromes, particularly fibromyalgia, where we could now have pain of not just the joints, but also the muscles, the skin, along with other generalized symptoms of fatigue and poor cognition or brain fog, along with mood symptoms like depression and anxiety. So I do think where we stand right now, we probably have an umbrella of issues that fall in the category of fibromyalgia. I think we just don't diagnose well. We don't have the technology. We don't have the research to diagnose those well. But with fibromyalgia, it's the one condition that, well, probably listeners may be more expert than me on this because so many individuals are personally affected or their families are affected by fibromyalgia. But it's the one chronic pain syndrome that can cross all of them, that can mimic musculoskeletal or mimic neuropathic or mimic an immune related. It can be very frustrating because of the nature of the symptoms and pain with fibromyalgia. There's often a number of procedures and diagnostics that happen, and they're not coming back with any one diagnosis. This is, yes, it's this, yes, it's that. So when I meet patients that have fibromyalgia, or I potentially am the first one to diagnose them with fibromyalgia, I try to be very careful because I don't want them to think that it's all in your head. No, I actually do believe they're having pain from something. I think that science has not caught up to what's happening in their bodies. Fibromyalgia is definitely a dense, separate topic, but I did want to mention it here as a source of chronic pain. And then finally, chronic fatigue syndrome, which I think it falls probably going to be an umbrella diagnosis, but at least currently we consider it as a widespread, non-localized syndrome where there's pain and fatigue throughout the body and can often mimic other syndromes. That is sort of the brief discussion on chronic pain. And I'm touching on the topics that I see the most. And keep in mind, I'm internal medicine. So if I practice a different specialty, my list might look very different. Like if I was an orthopedic surgeon, my list might look different. Or even if I were like a gastroenterologist, I may have a different list of, these are the conditions I feel I see the most as far as chronic pain. But in my practice, which is, primary care, internal medicine, these are the things I anticipate seeing throughout my day and the things that I try to keep in mind that we want to be having a good plan for because they won't have an immediate fix more than likely. So thank you so much for joining me for today's topic. For the second of this series, it is going to be approaching chronic pain, part 2, but I'm going to start discussing some of the treatment options that come up in chronic pain. And again, because I do feel that this topic is underserved, underdiscussed, and potentially can happen to any of us. Any of us can suffer a chronic pain that I think it's worth touching bases on and reviewing. So next in this series, I'll be discussing treatment options and approach to some of the holistic remedies. Again, thank you so much for joining me. I am a physician full-time, and I'm a beginning podcaster. If you are enjoying my podcast, I would really appreciate if you could leave a review if you're listening on Google Podcast or if you're listening on Stitcher. I would so appreciate that. And also, feel free to leave me some feedback. I'll make sure to leave some of my contact info along with my website in the podcast description. Thank you so much, and until next time, bye-bye. Thank you so much for joining me for this episode of the Art of Healing podcast. Once again, this is Charlize. You can find out more about me at www.healingartshealthandwellness.com. Did you know I have a blog as well as online courses? Check your show notes to sign up for more information about Healing Arts Health and Wellness. Thank you. Please feel free to share this episode with your friends, family, and loved ones.